Well, good morning, Mr. Gerber. You're observing surgery on your right eye. Dr. Shoemaker will begin with a small side port incision. Additional numbing medicine is instilled here to help you stay comfortable. Recent tests from our clinic confirmed that the cornea in this eye is more oval than round, a condition called astigmatism. Dr. Shoemaker prepares this limbal relaxing incision where the white of the eye meets the cornea. It does round the cornea, helping you to see better, and this is called astigmatism treatment. These are paired incisions that treat astigmatism. Dr. Shoemaker knows where to place them, how long and deep to make them from analyses of those preoperative topographical tests that were run in our clinic. And it's very typical for there to be a little bleeding because this incision is very close to the small vessels in the white of the eye. The bleeding will, in fact, help the healing process. Dr. Shoemaker prepares the main incision and places the cystotome through it so that it passes under the clear cornea to reach the posterior chamber. Now, the normally clear natural lens in your eyes become cloudy, so it's called a cataract. Of course, Dr. Shoemaker wants to remove it, but it's inside a small capsule. To reach the cataract, Dr. Shoemaker is opening that capsule now by peeling away its delicate front membrane in this circular motion. This will make a very small opening to expose the cataract for removal, but the capsule will stay in place because it will hold the new lens you'll receive in just a few minutes.
What's he doing?
Still taking off them.
Okay, all right.
Next, hydrodissecting fluid is instilled, and this separates the capsule from its cataract. Through the new opening in the capsule, Dr. Shoemaker can directly access the cataract with this special probe. This instrument has a hollow tip that vibrates at about 40,000 cycles a second. It also emits ultrasonic waves, and so it's working pretty much like a mini vacuum as it loosens and draws the nucleus of the cataract.
Is there a stitch involved after the
Not anymore. It's only an 1/8 of an inch incision. On the right, this nucleus rotator will help divide, turn, and just pretty much disorganize the cataract, which is all the dark and hazy material in the center. And that cataract will start to tumble rapidly as it's disintegrating. The fragments get small enough to enter the hollow tip, so they're swept into the vacuum-like probe on the left. So see all that milky hazy? That's supposed to be clear like a window. So that's his view of the world. He's going to be very pleasantly surprised at how bright everything is. And your brain adjusts. You just adapt, and you think that's the way colors are supposed to look because it happens pretty gradually. And you think white, gray, and yellow. They're really white, but to him, I'm sure they've looked either gray or yellowish or creamish. Just that quickly, Mr. Gerber, the nucleus of the cataract has been removed. So Dr. Shoemaker has changed instruments to irrigate and aspirate the softer part of the cataract that remains around the periphery. That capsule gets brighter as it's cleared because light can reflect off the retinal screen all the way from the back of the eye again. That's a goal of the surgery. So we're seeing delicate vessels in the back of the eye, giving it that bright amber color. Well, congratulations, Mr. Gerber. You no longer have a cataract in your right eye.
How soon will that bleeding stop?
Oh, probably before you even leave here in the
Okay.
next 10 or 15 minutes.
Okay. will there be like an antibiotic drop?
Yeah, they'll
Or
tell.
the drops that he had been using, will
Yeah.
that be continued?
You'll have 2 different kind of drops, and when we finish here, I walk you to post-op, and you talk to one of the nurses. They tell you everything to do till post-op appointment, till you go see Dr. Bachhold again. The capsule is clear, and now Dr. Shoemaker delivers the new lens from this cartridge. There's the optic body unfolded, and this flexible blue arm at the bottom is one of the 2 haptics that stay attached to the lens to maintain its position in the capsule. And I thought I had a lens here to show you. Yeah. I'm going to show your wife a sample so she sees how small your lens is. Dr. Shoemaker adjusts and rotates the implant. The plan is to securely center it on your line of sight. And of course, that lens has your prescription right in it, Mr. Gerber. So it brings back your focusing ability to the days of your youth.
He'll like that.
And all assisting agents like viscoelastic have been withdrawn. Dr. Shoemaker pressurizes the anterior chamber here. That helps to seal the small incision, so a stitch is seldom necessary. Then Dr. Shoemaker will confirm a watertight incision and make any adjustments that might be needed before concluding surgery. Everything looks good. Thank you, Mr. Gerber, for entrusting your eye care to Center for Sight. Those little sponges he's using there are really only that big.
Uh-huh.
Pretty amazing technology.
It is.
He's going to give you a thumbs up before he goes out, Mrs. Gerber, and let you know it went just great.